Hi, my name is Julie Peterson. I'm a psychiatric nurse practitioner at Purdue University Global. The video journal tonight is about a patient that I had an interaction with just this past week, Saturday. And when I met the patient, my preceptor had already, seen the chart and looked at him and talked to him for a minute. But I hadn't had, the beginning of talking to him or seeing the chart, kind of knowing what his diagnoses were. So to me, he just kind of looked like a regular guy that had some anxiety and stress going on. Wasn't quite sure what his prior diagnoses were. So just kind of talking to him, you could just tell he was when he came in, he was a bit delusional when he was just describing what he was seeing. So I immediately felt some empathy for the guy, young guy. And you just kind of wonder what people go through in life sometimes, that winds up to be so hard, how they get to where they're at. So I know that I can you know maybe be I try to be nice, I guess, is what I try to do. And then sometimes kind of clouds it, when you see a patient, you start thinking about who they are and what they're doing. And um, kind of not realizing what medications or something that they need to be on, being that you just met them for a second. So just hearing him talk, he just kept going on. And at first I just thought he was just a guy who had a lot of, just kind of right now their issues. And I didn't realize he had, the prior diagnosis of bipolar. Um, he had talked about his mom a lot and how his mom wasn't there for him. And then, interesting, all of his tattoos that he had all over him. He had them on his neck and on his arms and his hands, his fingers. And they all said upbeat things like dreamer, and they had musical notes on him, different things. And he had a pretty little green mark on his neck. It was kind of like a cross. It wasn't a Christian cross. It was, I guess, Justin Bieber has one just like it. So that's where he's got it from. And his hair's teal, just like Justin Bieber's. So you could tell that he admired him. So none of his tattoos said anything about anger and hate, and wasn't ugly. There were no skulls and skeletons and bones and inappropriate pictures of women on there. So it was kind of interesting to see that. But he does have a diagnosis of bipolar um, too. So he was on some other substances, some illegal substances that had caused his psychosis. But we saw him the next day too, and so he pretty much cleared up. But just for me, I think that a lot of his troubles probably came out when he was a lot younger. With his mom. He said his mom's a user and stuff. So I think there might be some ideas about what is going on with him versus what um, is his mom's fault. Which he's old, too old to be blaming his mother for it, which is what we had pointed out to him. But he kind of kept going back to that. Wasn't in a good time for him to have too much insight into what had going on. So, but anyway, I do see this, before, just kind of where you kind of look at someone and you just kind of get a feel for them, and then you just kind of got to wait for it. You got to wait and see whether or not what your thoughts were real, and you just wait for them to keep talking. That's usually what I've noticed, is a lot of the patients, they talk a little bit too much at times, and they would have been better off if they cut it off earlier. So but they just keep talking, and just kind of keep them talking to see what else that they'll reveal to you, because sometimes they're guarded. But that's just kind of what I like to do, is just to talk to them and just try to get them to feel easy and talk more, and just tell you more about what's going on, what's thinking, and see if you can come up with a idea, present an idea to them almost like it's more like they just told you versus you told them. So that way they can maybe get some insight into the situation that they have going on. Anyway, that's all I have for tonight. If you have any questions, comments, or concerns, feel free to reach out. Thank you. Bye bye.